Introducing the StatLock Dialysis Stabilization Device for short-term hemodialysis catheters. The StatLock Dialysis Stabilization Device is designed to eliminate suture securement and prevent the risk of accidental needle sticks to healthcare workers. The StatLock Dialysis Stabilization Device is an evidence-based method of catheter stabilization that meets the 2006 INS standards. In fact, OSHA also recommends consideration and implementation of available, effective, and safer medical devices to reduce the potential for needle sticks by eliminating the need to suture medical catheters. So please watch and listen closely to this brief instructional video, and both you and your patients will enjoy StatLock devices' safety, security, and savings. The StatLock Dialysis Stabilization Device is compatible with most short-term hemodialysis catheters. Be sure to confirm compatibility prior to use. Notice that the insertion site and the StatLock device securement site are separate and distinct locations. Care of the insertion site should be in accordance with your institution's policy and procedure and does not change with the use of StatLock stabilization devices. Applying the StatLock Dialysis Stabilization Device is as simple as prep, press, peel, and place. Preparation of the securement site should proceed as follows. After the dialysis catheter has been inserted per manufacturer's instructions, carefully clean the skin of blood and fluid. First, prep the entire securement area with 1 to 2 alcohol pads in order to cleanse and degrease the skin and to remove any betadine, oils, or lotions if present. Allow it to dry completely. Second, and very important for skin protection and enhanced adherence, apply the provided skin protectant pad and allow it to dry completely for 10 to 15 seconds. Finally, apply a tincture of benzoin and allow it to dry, tacky dry. Proper skin preparation is essential to the success of the StatLock Dialysis Stabilization Device. So once again, first alcohol, then skin protectant. Finally, tincture of benzoin, and remember, when using each product, allow each to dry completely. Now, orient the StatLock dialysis device so that the arrow on the retainer lid points toward the catheter tip. Always secure the catheter to the StatLock device before applying it to the patient's skin to avoid exerting undue pressure on the patient. Therefore, first press the catheter hub into the retainer at the point of bifurcation and close the lid. Then, peel away the StatLock device paper backing one side at a time and apply the StatLock device anchor pad to the patient's skin. The dialysis catheter is now secure and without risk of suture wound infection. The StatLock Dialysis Stabilization Device should be monitored daily and changed when clinically indicated, at least every 7 days. In most ICU settings, the StatLock dialysis device will stay secure an average of 4 to 5 days. Before removing the StatLock Dialysis Stabilization Device, clinicians are strongly advised to take the following 3 measures to avoid inadvertent dislodgement or migration. First, apply the sterile StatLock device adhesive strip at or near the insertion site. This will provide temporary securement during removal and replacement of the StatLock device. Second, if at all possible, place the patient in a horizontal or near horizontal position. And third, take the weight off the catheter pigtails. Removing the StatLock Dialysis Stabilization Device is easy. Just disengage and dissolve. To disengage the catheter from the StatLock device retainer, first stabilize the catheter. Then place your thumb on the retainer tab. Press and lift the lid and gently lift or remove the catheter. All StatLock devices have a custom formulated adhesive that is alcohol soluble. Therefore, to remove the StatLock device anchor pad, simply take 3 to 4 alcohol pads and squeeze a generous amount of alcohol near the edge of the pad. Then lift the corner and gently stroke the undersurface of the pad while continuing to lift. Using the StatLock Dialysis Stabilization Device is that easy. For application: prep, press, peel, and place. For removal: disengage and dissolve. 2 of the StatLock device models secure long-term hemodialysis catheters: the StatLock Dialysis Stabilization Device for Tessio and tandem catheters, and the StatLock PIC2 Stabilization Device for ash split and maxid catheters. The StatLock Dialysis Stabilization Device, designed to be faster, easier, and safer than suture securement.